We are a vaccine platform company developing vaccines based on our proprietary platforms. And how can we have projects within both pneumococcus, immuno-oncology, e-tech, chlamydia, tuberculosis, and as all decent vaccine companies, COVID as well? It's because we have a plug-and-play platform where we can decorate outer membrane vesicles with different kind of antigens, and in that way design new vaccines. These outer membrane vesicles are coming naturally out from the outer membrane of negative bacteria, and they are including the components that exist from the membrane. Our core competences is this blue stem, as you can see. It's a protein where we can attach other kind of antigens in a very simple plug-and-play method. So we are producing these vesicles, or bacterial vectors that we also could call them, in a very simple bacterial fermentation process. Then we are producing the antigens separately in bacterial fermentation, as we do with the pneumococcus, or in any other expression method, like mammalian for our COVID vaccine. And when we are mixing this, we get a covalent binding between the antigen and the vesicle, and forming this final substance that you can see over there. And the good thing with it is that it looks like a virus, both from a structure perspective and from a size perspective, and it has the bacterial components. So it makes it very potent for the body, and it recognizes it very strongly, which we can see gives efficient vaccine candidates. And the advantages here then is that we can make easy to and fast to produce vaccine candidates. The production in itself is very cost efficient because it's few methods, it's bacterial fermentation, and it's easy purification. We don't need any adjuvant because the vesicle in itself is giving an intrinsic adjuvantic effect, and therefore we also get few raw materials, so to say, and less risk. It's safe and it's very versatile because we can develop vaccines both for mucosal, so nasal spray for example, and parental administration, as we do within our immuno-oncology. And now we were founded 2012, so quite long ago, but we have been spending quite a lot of time in developing the platform, and we have done so through grant financing mainly. So more than 2/3 of the investments into the company has been through soft money. And it's only lately that we have started off a journey with more private investments and an IPO 1.5 years ago. And now we are going from this science-centric spin-out to a clinical stage company where we are taking our lead candidate, AB0112, against pneumococcus, to clinic during next year together with our collaboration partner at Radboud University. We are also exploring the possibilities with this platform in immuno-oncology, which I will come back to later. And we have collaboration projects in early phase within COVID-19 with Johns Hopkins University School of Medicine, tuberculosis, e-tech, as well as chlamydia, where we are having a large EU project ongoing right now. But let's focus on our lead candidate, the pneumococcal vaccine. Pneumococcus is a bacteria that cause mild things as otitis media, but also very severe diseases as severe pneumonia, sepsis and meningitis, and which are very deadly, especially for kids and for elderly. So we have around 1.5 million deaths per year caused by pneumococcus. And almost half of that is among children. And it's estimated to be like 30 million hospitalizations around elderly. So you can see it's huge costs for the society. But there are other challenges. These pneumococcus, as you can see on the picture, they appear in different variants called serotypes. And it's 97 known serotypes today. And the existing vaccines are all heading toward serotype specific or are serotype specific. So Prevnar 13 are heading towards 13 serotypes, but it's the most sold vaccine in the world, except from COVID now, with sales of $6 billion US. There are also a couple of other vaccines on the market. They are targeting 20 to 23 different serotypes. But there are challenges in this kind of technology because if you look around the world, there are different serotype prevalence. In some countries, there are some serotypes that are more common, and in other countries, there are other serotypes that is more common. And what we can see as well after some years with vaccination is that you get a serotype replacement, which means that when you start vaccinate, you are targeting the serotypes that are causing most invasive diseases. However, what we could see in Sweden was that after 10 years it was going from 75% down to 30%, and still we have the same prevalence of severe pneumococcus disease. So we get the serotype replacement, which also are challenging, together with increasing antibiotic resistance as well. So the expertise in the area, at least from an academic perspective, if we will not look at the commercial, are all agreeing that we need another way of meeting pneumococcus disease. And we are taking another approach. We are making a universal vaccines. Instead of the traditional ones going for polysaccharides, we are using what's called conserved antigens. So they are common for all the different pneumococcus serotypes. We are attaching them to our bacterial vector and get a vaccine that is universal. It's given as a nasal spray, and it's very efficient in hindering colonization in the mucosa, which means that, as you understand, the bacteria gets in through the nose. If we can stop it already at that place, we can stop it from causing a disease, as well as we can hinder the transmission, and in some way also lower the burden of disease in the society. Now we are taking this product from the lab bench to the clinical trials. We have a very extensive preclinical program together with Radboud University. We are we have already made a production process, an upscale production process, which also turned out to show that it will be a very cost-effective vaccine. With this material, compared to the existing ones, which are very expensive to produce, on the other hand, we will probably be around 10% of the cost of goods. And now we are heading towards the tox study and the first clinical trials during next year. On top of that, we are we will use a human challenge model, which will give us indication on the efficacy already at a phase 2A. And there are a lot of things going on, and it's a large market in this field. The market in itself is over $7 billion US. We had during spring a large deal where GSK acquired Affinivex for over $2 billion US. And we have a competitor that still is doing a serotype-specific vaccine, but is within phase 1-2 and has a value of $1.5 billion US. But as they were saying on the opening speech, it's a different story there on the other side of the sea. I will also touch a bit upon our approach within immune oncology, because as I explained for you, we can change what kind of antigens we put on this bacterial vector. And within immune oncology, we are now exploring an approach where we are decorating the bacterial vesicles with neoantigens. And neoantigens, as you know, it's personalized vaccines. And here the important part is how you fastly go and from the biopsy to a new treatment in a short way and in a very specific way, and still get on not only one but many neoantigens. And what we do, we have a delivery vector. We collaborate with neoantigen companies that is really good in detecting and prioritizing neoantigens. And we use our platform as a delivery to that, enhancing the immunogenicity, which we can see is a problem for some of the other approaches within neoantigens. And since we are having a platform where we can produce the vector already in advance, having more or less in the freezer, we can also make this in a very fast way. The same holds for pandemic preparedness, where we could have our platform in the freezer when a new pandemic virus or bacteria comes. We just produce the antigens and attach them, and quickly could have a first candidate. So as a summary, we are having a lead candidate within pneumococcus that enter clinical phase next year. We also, on our platform, are exploring immune oncology as an area within neoantigens, and we are having a pipeline of collaboration projects within COVID, tuberculosis, ETEC, chlamydia. And we can do so because we have a very versatile platform. And that's what I was planning to talk about today. If there is any questions, maybe. As always, maybe not.
Thank you so much, Maria. Any questions? Yes.
Hi, thank you. What is the COGS of decorating your vesicles?
So the COGS in itself, it's a very cheap process. It's a very simple process. So the COGS is mainly what it costs for bacterial fermentation and for the fermentation of and the purification of the antigen itself. What you do is actually mixing these together in a couple of hours, and you don't need to add any extra. It's no chemicals involved. It's a natural process. So more or less nothing.
Any more questions? We have about a minute left. No? Well, make sure to reach out to Maria while she's here if you have any questions later on. Thank you so much.
Thank you.